Welcome to Healthy Skeptics, where we take a no BS approach to holistic health.
We're a mother-daughter duo who believe in redefining health by going beyond rigid protocols, detox fads, and restricted diets.
Here, we dig deep into root causes, challenging traditional and holistic medicine, and talk about what really works in today's world to help you feel your best.
Join us as we sift through the noise, tackle myths, and offer real insights into holistic health with a healthy dose of skepticism.
All right, welcome back to another episode of Healthy Skeptics. Today, we wanted to...
I'm excited because we
have our first guest today, which is very exciting. And I'm going to let her introduce herself in just a second. But I wanted to introduce the topic a bit because obviously when we hop on this podcast, it's to talk about things that bother us in the health and wellness space. And one thing that's been coming up frequently over the last, I'd say 2 to 3 years, that's become very popular is the idea that you need to heal past trauma, or that trauma is somehow blocking your healing and you have to dig through it in order to move forward. So women that are experiencing hormone issues or gut issues or energy or weight gain or any of these like women's health issues, that trauma is, or dealing with that trauma that you may have had in the past, whether it's childhood, et cetera, is something you have to do and that it's blocking you from moving forward. And this is something that I kind of call BS on. and from our perspective, my mom and I, we work with women every day that are chronically stressed and they're burnt out. And a lot of them have dealt with trauma in one way or another. But even though trauma may be what we call like a root cause of some of the stress that they're under or the reason why they're super depleted now, most women, again, from my perspective, and this is why we wanted to bring on our guests today to talk to this, because I'm not a therapist, but from what I've seen is most women don't actually need to unpack more trauma. Their bodies need safety in the moment. And this kind of popular advice about releasing trapped trauma, often what we see, and we get into these like battles with some of our clients that are doing trauma work, because they're forcing this trauma work before their nervous system is actually ready. And when they do that, it almost like re-traumatizes them. It's keeping them stuck. It's keeping them in this chronically stressed out space. And so again, wanted to bring someone on that's actually worked with countless people navigating trauma. And fun fact, she's a former client, which is a nice way to segue into this conversation just because she knows us well and our opinions and thoughts. And so she's coming at this kind of not from just a professional perspective, but also experience. So we're going to dive into all of that today, and then hopefully also break down some more practical ways that you can start feeling better, especially with the nervous system, or if there is current trauma that you're experiencing, how to deal with that without harming yourself further. So that's where we're at today. I'm going to throw it over to Adriana, who's our guest, and let her introduce herself, and then we'll jump in. So, hello.
Okay. Well, hello. So I am Adriana Mattingly. I am a clinical therapist, studied clinical social work, and I have been in this field specifically working with trauma. Oh my gosh, I'm going to have to do the math now. 9 years?
Right.
I think I started back in 2016. And a lot of the work that I have done, while I have worked with a lot of men, I've worked with more women. Oftentimes we see that happening within the mental health system. So obviously this is something when we're talking about women's healthcare and overall health, get really excited about it because these are the clients that I see so much. So I still operate out of my own practice. I have a little practice downtown Charleston, and I see clients for trauma therapy, but also just for anxiety, depression, all the things. So I'm super excited. Obviously, mental health is my passion, and I will say super excited a lot because I am super excited. Can't wait to get into this conversation and love these ladies and what you guys have done for my health. So
yay. Okay, perfect. Well, let's scoot right on in. I'm going to drop a bomb like right at the beginning.
I'm ready.
So
We do best, so
yeah,
might as well go there.
Ready.
Okay. From your perspective, when you hear, like, in the mainstream wellness space, you hear the term trapped trauma, or that trapped trauma is somehow the root of all of your health issues. You know, and I guess I'm inundated with it every day, but it is something I hear often. How is that, in your opinion, like an oversimplification of things, or is it some, and this is, you can also disagree with me too, because that's why I want to have a conversation. If you actually do fall more on that line, that you think that trapped trauma is a really big root cause, or how do you feel about that term as far as when it comes to like the root of more physical health issues that you may see?
So this is definitely one I will say, especially like in health spaces, but also, with all the social media nowadays, like I feel like with TikTok and all the things, it's always talking about trapped trauma and everyone is over identifying with it. And I don't want to say this in an invalidating way because everyone has their own lived experience, but oftentimes I feel like people are just, and I get it, I'm a complex human being too. So like sometimes I want to make sense of something in an easy way. And so I'll kind of cling to whatever it is. But I feel like it can actually be really harmful when we are overusing this term, or even this oversimplification of trapped trauma being the root cause. Because here's the thing. We are complex beings. If we are saying that, then we are not taking into account anything else. Our bodies are so important when it comes to how we even manage anything that happens to us. So let me just kind of back it up, because I think it's also really important to talk about what trauma is. Okay. Because trauma is not the event that happens. Okay. Trauma is the body's and mind's response to what happens. So someone could have a seemingly what someone would call traumatic event, but they may not have trauma because it's not about the event that happens. It's how you actually respond. So that's really important to keep in mind too, because oftentimes people might be like, oh, well, that happened to me, so I have trauma. Well, you may not, because your body actually, I feel like we don't give our brains and our bodies enough credit for how resilient they are naturally. So I think that that's one of my biggest pet peeves. But then on to the next thing. We also have to think about, if we are looking at how are we going to be able to respond to stressful experiences in a resilient way, it's going to go back to the state that our body is in. So that's where I think we have to really, really look at what's going on within our body prior to trauma responses, because those things are going to play off of each other. So it's not this thing where it's like, okay, well, I have trapped trauma responses from one thing that happened to me when I was in middle school. And once I get rid of that, everything's going to be fine. No, that's just simply not the case, because it's not that simple. Also, another thing, and I'm kind of going a little bit on tangents, so feel free to edit. Another thing that I think is important to note too, is that when we're thinking about trying to heal trauma, we have to be able to set up a good foundation to be able to do that. Okay. So to say that the root cause and to heal and get rid of all these gut things is to just release trapped emotions, it's not going to work if that's all we're doing, because we have to make sure that our body is in a state to be able to actually do healing and feel safe within itself. So, you know, I don't know. It's one of those things where as a trauma therapist, I do 100% believe that there are so many things, so many trauma wounds, which again are the responses to things that can have a lot of healing to do. And that also those wounds can get in the way of some of the things. But you will never catch me telling any of my clients that trauma work is going to be the one thing that is going to fix all of it. And actually, especially thanks to you ladies helping to open up my eyes, the amount that I encourage people to make sure that they are checking in on their body, literally not just like where they're feeling emotions in their body. I mean like systems. Are they eating? Like how's their digestion? How's their sleep outside of just, do you have good sleep hygiene? Like what's going on in your body? Because if you're not doing that, what we're doing together, it's going to be really hard because your body's still going to be in that fight, flight, or freeze response.
Yeah.
Go ahead.
No, I was just going to say that. So a lot of the things that you're talking about, I mean, which, we 1000% agree. But a lot of those things that's come from you, like kind of as a postdoc. I mean, it's like learning this outside. This is not how therapists are trained to see a person or to see an experience. Like that's not correct.
So that's such a good question. And I'm so happy you brought that up. So it's interesting because in a way, when we're trained, we are trained before we diagnose, we are supposed to rule out any medical stuff. The thing about it is though, is I feel like they focus so much on like big medical diagnoses, right? Like, are we ruling out that you don't have like diabetes or like any big name? It's not focusing on, well, there can be other physical things going on. So really, it's kind of like a checkbox, like, oh, you don't have any big medical diagnoses. Okay, then here we're focusing on mental health. And interestingly, like I have noticed such a shift in my practice. And I think it happened around the time that I became your client and then also was like getting trained in some things because I was noticing that a lot of the traditional cognitive behavioral therapies, which I was a subscriber to, and I don't dislike them. I just feel like they miss something because it's really focusing on how our thoughts impact our feelings. And if we just change our thoughts, then we'll feel better. And it's not that simple. And I saw that with my clients because I would do I was the clinician who would, I'm going to say it, re-traumatize them. Thank God some of them came back and I've been able to see some of them since, and we've been able to do better work and it's been even better. But I was the one who would do these cognitive therapies who wouldn't necessarily even check in on the central nervous system before we dove in. It was one of those exposure things where it's like, let's do it. The more that you do it and the more that you ride it out and feel the intense emotion, you're going to feel better. But guess how many people avoided me after? A lot.
Yeah.
I think it's interesting because that speaks to like our side of things. Because even when we test someone, so from a resource perspective, like does your body even have the minerals required to have an appropriate response to stress? Because when we're stressed out, when we're in fight, flight, or freeze, we are burning through our resources at a very fast rate. And so a lot of times what we see time and time again is women that have no resources left. They are done. So the body's not even in a place where it can respond to little stressors well, like being in traffic or being late to work or spilling coffee on yourself in the morning. Like we have these extreme reactions to little things because we don't have the resources to respond appropriately. So in my brain, I'm like, great, let's throw them into talking about horrible things that happen
Right.
over and
Throw you
over
in
and
the deep
over
end.
again. Yeah. And I'm like, okay, this can't be good. When in reality, like, I feel like there's a timeline, and maybe you can speak to this, but I feel like there's a timeline of when that is appropriate. And sometimes it's never, like, it doesn't ever have to be appropriate. Like you were saying, I loved when you were like, actually, sometimes experiences don't result in trauma. But I feel like there's a timeline, and of when it would be appropriate. So for you, when you're kind of like ruling out, or I guess at the beginning, ruling out medical diagnosis or whatever, what are you looking for now that would tell you like someone is ready to jump into exploring those things? Like, okay, you seem, well resourced, or these things are in, what are you looking for now?
So, I mean, one of the biggest things that I'm looking for is, how are they responding to small, minor things that are happening throughout their day? And so, the models of therapy that I really use now, which I mostly do EMDR, which really incorporates that central nervous system. And I use like some somatic therapy. So again, really honing in on that. And what we're focusing on in those, before we jump to, hey, let's jump in and talk about the thing that is the most horrific thing that you've ever experienced, and your emotions are going to go over to 100 and we're going to send you into a panic attack. No, we're not doing that. So before we even get there, what we're doing is we're trying to go ahead and like test out to see how people are able to respond when their central nervous system gets pinged. So even with the smallest things. So we're going to be practicing some like calming strategies for the central nervous system for them to be practicing regularly. We're also going to be, I might even do like an intro reprocessing of a recent event where they were stuck in traffic and they were yelling. And we're going to break that down and help calm down the system there and see how they respond first. Because what I'm trying to do is I'm trying to go ahead and test a little bit of that resilience first. Because what I don't want to do is jump in before they're ready. Again, potentially send them into a panicked state, fight, flight, freeze. And then what we have is we have a central nervous system that's locking us out even more. What we're trying to do is we're trying to build safety within their bodies. While they're present with me now, I want them to feel safety within their bodies going through their everyday, so that when it comes time to tackle the big things, which is what they're there to see me for, we're good.
Yeah.
I love that.
And so I'm a little bit scared because I am always educating people while I am driving. These people out there need a lot of education. Sometimes you need to speak very loudly so they can hear you, educate them on their driving. I'm just saying.
I mean, I say that. I definitely have had to reel myself in. The let them theory lately has really helped me to reel in my road rage at times, because I'm like, okay, let them drive like a fool. It's fine. It's fine.
Have you read her book, Mel Robbins? Have you read it yet?
So I listened to the whole Audible and I'm obsessed.
Okay. Yeah, so good. I haven't finished it, but it's phenomenal.
I've actually been recommending it to so many of my clients because I feel like she does such a good job of explaining. And again, how she explains that like emotional responses are actually like a science, like physiological, right? So like we cannot separate the brain from the body. If we're going to work on any part, we got to work on the whole system.
Whole system. Yeah. So, yeah, we almost get into that. Well, we do get into it a lot with our work, because when we're working on, we work very intensely on the physical.
Yeah.
But we can't, it's not like you can, you can't ignore the mind, and you can't ignore like what's happening and how that connection, like I said, like when you don't have enough sodium, your body can't respond to stress, and now you're anxious or whatever it is, and so interesting, the connection.
Okay.
I am curious. Okay, so you mentioned EMDR and you mentioned somatic therapy. And I would love for you to clarify, because I think when we think therapy, a lot of people do think of cognitive behavioral therapy. Like that's what we know and think about. So with EDMR and somatic, if you can like explain that a little bit more, I think that would be really interesting. And then also how you see those things connecting to like the difference between nervous system dysregulation and a trauma response. Am I making, does that make sense? Question.
Yep, makes sense. So, so eye movement desensitization and reprocessing. Try to say that 3 times real fast. You won't be able to. So just EMDR. Also has been, I feel like, a bit more kind of trendy, which I'm all for. However, not everyone needs EMDR, just to clarify that as well. I feel like sometimes people will be like, oh, well, I have trapped trauma, so EMDR. Like EMDR is wonderful for what it does. And actually, sometimes I will use it for people who don't necessarily have trapped trauma, but they have these core beliefs that keep getting in the way, and we're trying to integrate with the central nervous system. So what it essentially is, when we're looking at traditional cognitive behavioral therapies, we're looking at these negative thinking patterns patterns of problematic thinking that are not helpful. So these are the like, I'm not good enough, I'm too overwhelmed, the world isn't safe, those. And we're looking at those as well with EMDR. However, the difference is we're trying to also tap into why are those beliefs coming up so strongly and impacting our body so intensely, right? So we're tapping into what's going on within the body. The other thing too that I think is really important is with cognitive behavioral therapies, we are oversimplifying it to just change your beliefs and then you'll feel better. And if you can't change your beliefs, then you're doing it wrong, or just keep trying harder and maybe one day you will feel better. And there's so much shame around that. The amount of clients, and again, because I was the CBT therapist that was like, okay, just fill out this worksheet and challenge that thought. And they're like, I logically know that this thought doesn't make sense, but I keep on telling myself this over and over again, and I still feel the same. And I'm like, well, just keep trying. It doesn't work because it creates so much shame around them. They're like, why am I like this? Why am I still feeling in my body this way? And so what EMDR does is it actually helps to tap into your body. So what it does when we're talking about EMDR, it uses bilateral stimulation. Okay. So that is, the traditional way is like people are following my fingers back and forth. But what it's doing is it is actually lighting up both sides of the brain. So we're getting the logic side and the emotion side. That's allowing us to tap into the central nervous system. When we go faster, we are tapping into the sympathetic nervous system. That's when we are at a point of processing. We're really in the trauma work, but we don't want to go there until we have really tapped into our parasympathetic nervous system, which is our rest and digest function, right? And a lot of times people might be coming to me and they are in a constant state of sympathetic nervous system. So they don't even know how to access parasympathetic nervous system. And that's what we have to do first. And so I love EMDR because it really focuses on building that foundation of let's make sure that we can feel safe in that first. And again, it really connects the mind and body instead of just making us feel like, well, we need to fix our thoughts and then our body will feel better. So we also use that bilateral stimulation in EMDR for tapping into the parasympathetic nervous system as well. We just do it at a slower speed. And we can find, I mean, clients don't have to go into EMDR to even use some of these skills. Walking is a form of slow bilateral stimulation. I mean, there are people who are already doing it. Like, I have clients who, when we kind of go in and we talk about it, about different ways, if you are lighting up, alternating, lighting up each side of the body, that's comforting. Some people are already doing it. They're like, oh, when I get stressed, I just start to great. Like, that's wonderful. So I think it's really, what I love is it really kind of helps people to see and feel empowered that they already have some of these tools to calm and tap into their central nervous system instead of fix your thoughts. So EMDR, obviously I love it. I've also seen a lot of clients. I've actually completed trauma treatments, cognitive behavioral trauma treatments with 3 of my clients before I was trained in EMDR. And okay, we made some progress, but we were still a little stuck. I am not kidding you. When we implemented EMDR, night and day difference in the progress, the way that they felt. And they even would say, when we got to the end of CBT, they would be like, I mean, I feel better, but I still feel just kind of a little stuck. When we were able to really tap in to their central nervous system, which is a central part of their functioning, they felt so much better. And it was the coolest thing to see. So that's why I love EMDR. And somatic experiencing also really, really hones in on the central nervous system. And so, like, somatic, I incorporate some of their ideologies. I also incorporate some woo-woo internal family systems. But again, all of this is really tapping into our body's systems. Somatic experiencing is one of those I honestly would love to be like eventually trained in, but the wait list is forever long. But it does, again, it does such a good job of helping us to notice. They will identify emotions that might be trapped in the body, but not from a standpoint of, if you have something that's trapped in your body, you need to release it in order to like be able to sleep.
Right.
It is a, hey, let's notice as we're going through this. If I'm starting to feel dysregulated, what am I noticing? Is there anything that I can release right now? Right? Instead of, oh, I'm noticing something. I need to go find something in my past that potentially is trapped. And that's the difference.
Yeah. Kate and I talk about that too, where, I mean, and her background is in psychology, mine is not. You know, we get like a nanosecond of that in medical training, about the same amount as nutrition. But we talk about, you know, I know, exactly. But we talk a little bit about that in using a past experience that had happened, a negative past experience or positive, I guess either way, but mostly negative, to pull that forward in order to change a current behavior, to make a connection so that a person can understand perhaps where that is sourcing from and make a change. Am I getting that right?
Yes, absolutely. And, you know, sometimes like, you know, if we might try to pull back. And like, I'll be like, well, let's float back and let's figure out a time maybe in your past when you felt similarly, because sometimes that can help us go back there. Other times that may just be like, okay, let me connect back. Maybe it wasn't the most horrific thing, but if we can tap into that emotional sensation and then again, tap into the sympathetic central nervous system to be able to reprocess and calm. It doesn't have to be a big trauma, but if we can speak safety to the central nervous system around that similar experience, then we're doing the work. And so, you know, I'm not in the business of trying to recover memories. Absolutely not. If someone comes in my office and they're like, I just want to see if anything happened to me, you know, when I was younger. That is not, if through our work together that comes up, we will absolutely deal with that. But I'm not in the business of recovering memories. That's not necessarily helpful. What I'm trying to do, even in our trauma work, is we're not trying to relive the memory. What we're trying to do is we're trying to get the brain to the point of realizing we are no longer in danger. We don't need to be firing off our sympathetic nervous system anymore because we are safe. That's the goal. It is not, and I used to be this person, to do exposure until, like, I feel like that's almost like waterboarding. Like, here,
Mhm.
lay down.
Yep.
We're just going to dump this water on you
Mhm.
until all of a sudden you're numb and you're good.
Yeah. No, it's funny.
100.
My family makes fun of me because I always say, it's police taped. We're
Yeah.
not going back there. We'll just move on. And it doesn't need to be re-experienced. There's no reason for that, except in cases where there's a piece of it. But we do that a lot. You talk a lot about the central nervous system and getting into that parasympathetic state where we feel safer,
Mm-hmm.
and it's like, we do that from a physical side. Like Kate,
Right.
if you don't have the resources, just from a basic mineral nutrient standpoint, you don't have the resources for your body to tap into, it can't even get there. Like there's no energy to be able to even, get to that place of safety, because you may be able to control the mind's piece of feeling safe in the moment, but the body is still freaking out. Like it's, no, like I can't do that. I can't go there, and we see that we've gone through that with, and currently go through that with that, are stuck. They're stuck in a high anxiety, high stress, and they view it as being because of my past experience. So it's like, and then you're trying to work on the physical too. So I mean, there's a fine line, or there's and a big, and maybe even a bigger connection of the two that have to go together in order to get the person back to being, a very well functioning, or optimally functioning body in a whole.
Mm-hmm.
It's funny because when you talk about EDMR and then when you talk about somatic experience, my brain is like, well, the reason why that also I would see that as it working better is because it's bringing people back into a very present moment. And yeah. And so, and when we say that, like bringing you back into your body, because the way to really calm down the nervous system, like you said, is to tell it it's safe. But you can't do that unless you're in the present safe moment. And then to your point, Mom, and it's what we try to do every day with feeding yourself regularly, not having erratic blood sugar, sleeping well, and whatever's preventing you from that, having internal inflammation like gut issues or dysbiosis or mineral levels that are off, or all of these things that actually create stress in the body on a physical level that has, nothing to do with like external stress. Keep your body in a very unsafe place. And so it is interesting, like from a therapy perspective, when we do more work from a present moment. And even if it's like maybe something traumatic happened to you in your past, but you're like, oh, you're having this reaction in traffic, like, let's just deal with that. And get you able to realize when you're stressed and how to calm back down. I see it in my brain as almost like a muscle that needs training, and being
100%.
able to have this flexible nervous system that can respond to stress well, and then also knows how to calm itself down. And we have to train that, especially when you are poorly resourced, or when you've had a lot of internal stress, or you do come from a place of a lot of external stress, or whatever that is, and the body is stuck. You almost have to retrain. And it's what I feel like EDMR and somatic actually does. It's like a muscle training. You have to build it.
And I think too, you're absolutely right. And I think one thing that, I've seen a lot of times with clients, but not only just clients, I feel like just in the world and the way that people are talking about this is there's this expectation that first of all, that the sympathetic nervous system, when it fires, like that's a bad thing. And the reality is the sympathetic nervous system is natural, normal. It should be there. We want our alarm bells to go off when there is danger. Okay. So a lot of times people like view this as like this horrible thing. Like we're not trying to get rid of that. And so sometimes people will want to like numb it or get away from it. And that's it. No, we need that. And so I think that that is one thing that I notice happening a lot. And so people have a misunderstanding about how our central nervous system should be working, right? We need to have a balance of both. And if your sympathetic nervous system fires, like you were saying, Kate, what we're trying to get to is you being able to recognize and be able to speak safety when it is safe and really tap into that parasympathetic nervous system. We want your central nervous system to be able to be flexible like that and flip like that instead of just staying in that constant state. And it's interesting because I feel like, you know, one of the things that, thanks to you guys too, has really helped is, I mean, sometimes I'll have clients who come in and they're like, I'm just still struggling. And I'm like, well, when did you eat today? It's like 3 p.m. And they're like, I haven't eaten anything, but I've had 3 cups of coffee. And I'm like, well, there you go. Right. Like, you know, so I feel like for me, thanks to you guys, because I needed this for myself, you know, how in the world are we expected to handle anything if our bodies are not regulated? I mean, to make it kind of basic, but it's a prime example, hangry. Okay. Everyone has been there. Everyone's been hangry. Imagine if you are hangry, and my husband knows what it's like when I'm hangry. Do not speak to me. Do not look at me. If you drop a pencil on the floor and it has nothing to do with me, I cannot recover. And again, like that's because my body isn't in a state to feel safe, to feel regulated, to be able to respond in a way that is more resilient. And so that, I mean, that's a very basic example, but it's so important to know, like, if we can't get past hanger, what makes us a traumatic event?
Oh, I know. No, and that's so true. That comes back around to like the very first thing you said, which was talking about resilience. And if you're, you know, so if you are a person who has a very well-balanced central nervous system that can go in and out of both sides very easily, response and relax, we'll say, right? It's like then when something happens, your experience is going to be different than someone else's who does not have that resilience and that ability to be flexible, go into the situation. And you know, I'm sure it affects you at a level, but it's not long-term disaster. It's just you're in the moment, you go through it, and then you come out the other side, and it you know, your body's able to come back to a place of safety and know that that was an event. It's not my life. It's not where I'm stuck. It's
exactly.
A lot of us have to train that resiliency from both physical, from the foundations of health, of eating better, sleeping better, you know, moving our bodies, all the things, and dealing with if there's any internal stress, and then also from if there is a behavioral pattern that's happening from that as well. I love the resilience conversation. And I love the flexibility conversation because I agree with you. I think a lot of people don't understand that they should have a good stress, like cortisol is actually a good thing. Like cortisol wakes us up in the morning and keeps us alive and is anti-inflammatory and like all these really great things. It's just, we don't want it all the time. And it is really, because nervous system work has become so trendy and because high cortisol is apparently the root of everything that's wrong with everybody. Everyone's very afraid of it. And it is funny because we have people, we can test through hair tissue mineral analysis, when we get kind of that breakdown of our nutrient mineral levels, or our resources is what I call it, we can see where your nervous system is. So we can see if you're somebody that has a flexible nervous system, or if you're stuck in either a sympathetic state. But I'll tell you, most of our women that we work with are actually stuck in a parasympathetic state, because of years of being, stuck in sympathetic, that now they're burnt out and their body can no longer get there. And so now they're stuck in a burnt out place.
Right.
And
which
that's
is what we don't want either.
Right.
Yeah.
And it's very confusing when I tell them, like, oh, like, you're actually experiencing all these things because you lack cortisol. And they're like, wait, what?
Yeah.
And then it's like, oh, now try to get them into a place where they could do any kind of trauma therapy. And we're just burning them out even more. Like, I can't imagine that response that they might have. When in reality, you're like, actually, we're going to stimulate the central nervous system. We're going to try to create a stress response that would get you out of this stuck place. It's very interesting. And nobody's talking about it.
No, you're right. It's been really, I think too, some of the things, when we say we call BS on it, I think it's more of the trendy things. It's not the, when you're like really in a good working relationship with a experienced and educated clinician, not the, people that just kind of come out of the woodwork and decide that they are going to do, somatic work or whatever else they're going to work on. My favorite, though, I have to say, and I have to say it because it was so ridiculous and literally I lost my mind for a week on this one, is I heard one of these people who, were trained by the 6-week program and now I'm a functional whatever, actually say that she wants to work on your preconception trauma. We're going to pull your preconception trauma out and we're going to, and that's going to heal you. I almost died. I was like, did I hear that correctly? I played it back. I think I probably still even have the recording.
I thought, I was like, she for sure misspoke. Maybe she meant like birthing. Like, I was like, for sure she misspoke. And she said, nope.
No,
actually
no.
not.
So you were in a zygote, or maybe even pre that. Maybe you were actually an egg or a sperm and you have preconception trauma from that union of creating you as a person. I have no idea what the heck that meant. I was just like, what? And that's where I think we started looking at what were like some of these trendy, let's dig through, your past trauma, which is kind of where that is. But this has been an amazing, like, really, and I appreciate you explaining the EMDR and somatic from your perspective, as a trained, clinician, to say, it's not for everybody. This isn't, you don't just run out and find whatever and just start working on it. I mean, it's something that, comes within the course of working with someone.
Or at least eat lunch first before you do.
Literally. I'm like, I mean, sometimes that's the first thing. I'm like, sometimes our basic goal for the next week is, what are some routine meal times that you can have? Can we at least eat something before coffee? Let's do that. Can we?
Yeah.
That's so
sorry to interrupt your train of thought.
It's okay. It's gone now. So it's totally train. It's gone.
Well, I do want to, so that comment about that person who is like looking for preconception trauma.
Yeah.
This, I think that, and that's one of the things that I get so frustrated by, is people are looking for it. We are searching for it. Now, here's the thing is, I 100% believe there's generational trauma. I have some clients who are so in tune, they are energy people, and like, we do a lot of great work. And there are times when I've had a few that have had like in the womb trauma because they could sense things. Listen, I'm not here to tell them, like, if their central nervous system needs to process it, that's fine. I will 100% believe that, but I'm not going to dig for it.
Yes.
Okay. Yeah. I'm not going to be like, okay, you seem really dysregulated and anxious. What happened to you in the womb? Okay.
Mhm.
No, that's if their brain, and usually their brain will take them there through reprocessing because it's a lot of the subconscious stuff that comes up. If their brain takes them there, I'm going to go there. As long as this feels like it's healing and adaptive for them, I'm going to go there. But I am not hunting for, I'm not going to just try to find a trauma.
Yeah.
It's so weird that people are like, it's almost like there's like, I would be curious what the psychology is behind us wanting to, and maybe it's a like I need something else other than myself to like put this on because it feels heavy. So we like search.
And I think
but it's weird.
As humans, naturally, like, I mean, everyone has it. Everyone wants to have some sense of control.
Yes.
And so, that's why we tend to like cling to these things, like anything that can provide an answer that can make us feel in control. Because if we can pinpoint exactly what the issue is, then we can figure out exactly how to fix it. And then we can make sure that we feel 100% better.
Exactly.
And that's the thing, is it's not that way. We are way more complex than that.
But
it's almost like, it kind of reminds me of, I don't know if this is as popular now, but like just thinking about people who would always like, like people who are like hypochondriac, who would like, they're like, oh my gosh, I started sweating. What does sweating mean? Oh, I'm going to die in 6 months. Right. And then like, I feel like this is kind of what I'm starting to see in the mental health side. And I love that people are talking about mental health. Love it, love it, love it. I'm a therapist, love therapy. But it can be harmful because we are inundated with information, with the way that technology is, constant people who are educating, I don't know who they are, and people are clinging to these things. And it's wild.
It is. It's this, I always talk about this we have this narrative that if we don't feel whatever 100% is, that we are somehow broken, and we're always trying to fix ourselves. And it's this constant like fixing. And that's basically what Instagram or social media or whatever has amplified, is this need to fix. Then we're micromanaging everything, and then we're looking for things, and we're hanging on to diagnoses as identity and all this stuff. And I'm like, have we all just like forgotten to live our lives? We all just forgotten to live at all?
Yeah. I know.
You're not like, or you're not broken. Like maybe your body needs some extra support right now, but you actually don't need to fix things.
Well, I hate, that is one of my biggest pet peeves, is this idea of fixing. And, I love my clients so much, and thank goodness they stick with me, because some of them get frustrated with me when they come in and they're like, still experiencing some symptoms. And I'm like, because you are a human being. You are going to experience, and when you say symptoms, what do you mean? Well, I felt anxious. Well, of course you're going to feel anxious. That's part of the human experience. You're going to feel anxious. You're going to feel overwhelmed. You're going to feel stressed. You're also going to feel happy. You're going to feel sad. You're going to feel excited. Like, we are not trying to erase this. What we're trying to do is, again, building up the resilience. So when you do experience some of these uncomfortable emotions, that you can feel safe enough to feel them in your body and not have to numb or go into that panicked state, right? So like, therapy should not be, and I feel like sometimes people go into therapy thinking it's going to be the thing that fixes me. It's going to take away all my emotions, all my difficult emotions. I'm never going to feel bad anymore. No.
No, then you're dead. Like,
what? Like, you can't, what? I mean, literally.
Seriously.
That's what. And it's just mind blowing. And so one of the things that I think is so important is to like refocus this conversation on not necessarily like, are you experiencing anxiety or like like, focus the conversation on how are we responding? What is our response like to these things? And can we adapt and adjust our response? And that's where we need to really focus the healing, because if our goal is to eliminate any of these like emotions or even which part of the central nervous system is firing, we are going to fail every time because it is not possible. And quite frankly, I don't want to do it because then you're not a human being. And like Dr. Michelle said, you're dead. So
amen. I want to end it there because that was just like so perfectly wraps up everything that I feel. I mean,
I'm glad I could provide that.
yes.
No, that really
Thank you for articulating that. Thank you so much for coming on. This was fun.
It
We'll
was
do
so fun.
more guests.
I know. No, I really
Yes.
I had so much fun seeing you guys.
No, it was so nice to see you. I also want to tell everybody out there too that, I mean, you know, if you are looking for a therapist, you know, we put all of the information so that you can reach out to Adriana and, you know, connect with her. And if anything that she was saying is really resonating with you and, you know, this is something that you really want to work on, highly recommend her. So, but we'll give you all that information. So look down in the show notes for that, for how to get in touch.
And I will add, also, if you're not 100% that, you know, EMDR is your thing, but like you have questions about therapy, also feel free to reach out. I know it can feel like really overwhelming to open up that can of worms. You don't know where to begin. I am also there as just someone, ask me questions. Like I will help point you in the right direction, get you linked in to where you need to go. So don't feel like if you're reaching out, it has to be because you want to see me as a client. Like I'm also here for questions because I want to help guide anyone.
Awesome.
Yay. Well, thanks again. And thank you for joining us, all you listening.
And pink and all in the pink, so it's so beautiful.
You know, it's the holiday of love still, and we're talking about loving our central nervous system. All of our parts.
Oh, wow. Okay.
So there we go.
Perfect.
Awesome. All right. Thanks again.
All right.
We'll
Thank
see
you.
All right.
Bye.
Bye.